And Your Excellency, this particular facility that we are now in was built in 2013 with the support of the Japanese International Cooperation Agency, JICA, in order to expand storage and handling capacity for vaccines in the Ministry of Health. And we are very grateful for this partnership. It has a capacity to store more than 6 months of vaccine stock for the country at any one time, and it boasts of more than enough vaccine cold and freezer rooms. Specifically, it can store 130,000 liters under 2 to 8 degrees temperatures and a negative capacity of 14,000 liters in the -20 Celsius, which means, Your Excellency, that we are able in this region, in this lab here, to even store the Moderna vaccines once we get them, and we are able to deal with just about every other vaccine, with perhaps the exception of Pfizer, that needs over 70 degrees. So this infrastructure, sir, is going to be key in deployment of COVID-19 vaccines. And for those of you who are wondering what will happen if this area suffers a power outage, I am happy to report that the facility has a standby generator and is able to run all the equipment at any time, all times, leaving nothing to chance. Your Excellency, I think I would also like to take this opportunity to mention that every year this facility handles vaccines worth more than 6 billion shillings. These include childhood vaccines such as tuberculosis vaccine, the polio vaccine, the pentavalent vaccine, rotavirus vaccine, measles, etc., etc. And from the ports of entry and the depots, vaccines are distributed quarterly to more than 8,000 health facilities in the counties through 9 regional depots. So, Your Excellency, I would like to assure you and assure Kenyans that we have capacity as a nation to handle the challenges that may come with the transportation, with the storage, and with the entire chain that is required to ensure that our people are safely vaccinated. So I therefore wish to assure you, sir, that the ministry will continue to invest in this expansion of the cold chain, and as noted, we have adequate capacity to manage all this. And I would also like to add, sir, that an appeal to our colleagues in the fourth estate, that even as we do this, as we carry out this activity, let us be sensitive to the information that might be passed around. For example, when we are talking about the costs of vaccine, sir, what we have got here has not been bought, not a single shilling has been used, as opposed to popular debates around how much, whether we are buying more than Brazil and other things. The truth of the matter is that the current vaccines delivered here by UNICEF we have not spent any money whatsoever. And with those very few remarks, sir, I just once again wish to thank you sincerely and invite you to please say something to our colleagues as well as the fourth estate.
Mwisho wa safari. Na tunataka kuhakikisha ya kwamba Wakenya wote wameweza kupata chanjo ambaye itawasaidia kuzuia huu ugonjwa wa COVID-19. Na hata wakati tunaanza hiyo safari, ningeendelea kuhimizia wenzangu wa Kenya ya kwamba bado jangwa hili la ugonjwa liko nasi. Tusione ya kwamba sasa madawa yamefika, maisha itarudi kikawaida. Naendelea kuwaomba kwa heshima kubwa sana Wakenya wenzangu ya kwamba lazima tuendelee kujikinga na huu ugonjwa. Lazima tuendelee kuvaa barakoa. Lazima tuendelee kusafisha mikono na kutumia sanitizer. Lazima tuendelee na mpangilio wetu wa social distancing, kwa sababu ugonjwa haujaondoka, bado uko nasi. Na yetu na kile kitu cha muhimu sana ni kuhakikisha ya kwamba tumezuia vifo ambavyo tungeepuka kama tungefuatilia masharti ambao tuwaendelea kupatiwa na wenzetu ambao ndio wataalamu wa kiafya na wako hapa. Najua tumechoka kwa sababu tumesema hii ugonjwa imetuharibia mambo mengi, na ni kweli, lakini naendelea kuhimiza kwa wenzangu ya kwamba mambo haya mengine yote twaweza kurudisha, lakini maisha tukiyapoteza hatuna nguvu za kuyarudisha. Na ndipo jukumu letu sisi wote ni kuhakikisha ya kwamba tuendelee kusaidiana na kujipanga kuzuia huu ugonjwa usiendelee kuenea na kupoteza maisha ya wananchi wetu. Kuna mambo mengine ambayo tutaongea zaidi hivi karibuni. Tutawaita tena tuwaambie pahali ambapo tumefika na mikakati ile ingine ambaye serikali itaweka tukiendelea mbele. Lakini yangu ni kuwashukuru wale wote ambao wamehusika, kuwaambia tuendelee kusaidiana, na wakati tunaendelea na huu mpangilio wetu wa kuchanja wananchi, tuendelee pia kujiepuka na huu ugonjwa kwa kufuatilia masharti yale ambaye tunapewa na wataalamu wetu wa kiafya. So ladies and gentlemen, let me just say it's a great pleasure and a great day of joy as we are here to see the launch of the distribution of this vaccine across our country to all the various regional centers, vaccine centers, and ultimately to the various health centers across the country in order to be able to facilitate our people to be injected with this vaccine as part of our process of combating and helping us defeat this deadly disease that has faced us, not just here in Kenya, but globally. To take this opportunity to also thank all our partners who have joined hands with us to help us execute this particular program, and to assure Kenyans that this program will be rolled out countrywide. And indeed, our policy, and it has been clearly stated, and I would really appeal to our colleagues in the Fourth Estate to stop disseminating rumors and half-truths. We have met as a cabinet and we have made it very clear that the policy of my administration is that the first persons to be administered with this vaccine shall be our frontline health workers. That is category number 1. Those will be immediately followed by our category number 2, which will be our police forces, our security forces, who also, due to the nature of their work, are also equally frontline workers. All emergency service providers will be in that category. Inclusive of them will be our teachers, because as you know, we have resumed learning, and our teachers are equally just as exposed, as we also move to those who have comorbidities and those above the age of 58, as we move to the rest of the population. So I would really plead with you to stop any kind of insinuation that may create dissatisfaction amongst your people. This is a time for us to come together and ensure that we are able to provide this much needed service, this much needed vaccine to our people. And we will walk that journey with you. As far as we are concerned in government, ours is to help these wonderful people who work day and night to ensure that we support them with logistics, that we support them to ensure that they are able to get the vaccine out, that we support them to ensure that we have enough doses to cover our population so that the exercise is continuous until such time as we have completely vaccinated our people, or at least have been able to achieve what we are being told is referred to as herd immunity. But it will be their responsibility. They are the experts. They are the ones who will guide us. And if you have any questions outside of policy, which I have just detailed out to you, of how this vaccine will be rolled out, that is policy. With regard to the execution and how it will be done, ask the professionals, ask the technicians, because it is in their hands. They are the ones who will be in a position to guide and to tell you how many doses have been distributed to what part of the country, how many people have been vaccinated, how many health workers have been vaccinated, how many policemen and security men have been vaccinated, firemen, all these frontline workers, how many teachers, and so on and so forth, so that we are able to report factually. We have got nothing to hide. We want to report factually. But that is not made easier when people depend on rumors. The professionals are here. Wapi daktari? Huyu ndio mwenye kiwanja. Mkiwa na maswali, ofisi yake ni hapa, jameni, njooni mumuulize. Wapi Amos? Huyu mwingine. Mkiwa na swali, muulize. Sisi mtuulize policy. Na policy I have just detailed out to you the policy that we are planned to utilize. The work will be done by these people, and ask them. They are available to you to answer whatever questions that you may have. Sini namna hiyo wenzangu. Na ndio tuweze tusaidiane pamoja na tuhakikishe ya kwamba tumesaidia taifa letu na tumesaidia wananchi wetu. Sisi tutaendelea, and I cannot but once again re-emphasize that despite the fact that the vaccine has arrived and will continue, because we will get more and more doses until we meet our requirement,